Welcome to the LDN radio show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose Naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us.
Today I'd like to introduce our guest, Sita from Canada, who's going to share with us her POTS and EDS story. So if you'd like to tell us your journey to how you got to where you are today, you can take your time, in your words, your story. Thank you.
Okay, thank you for having me. It's wonderful to be able to share this story, and my hope is that other people find answers quicker than I did, and learn from this journey. So I just turned 48, and I got diagnosed with EDS, hypermobile Ehlers-Danlos, just within the last 2 years. Before that, my life, I was always high maintenance. I always said I'm allergic to adrenaline, and I got tired out quicker, but that wouldn't stop me. I would just do what I could and rest in the background. And I always felt that I was different, and I even recognized in one of my siblings that her and I seemed to be kind of similar. And whereas the other siblings were a little bit more robust, and we were just a little bit more delicate. So I studied nutrition when I moved to Australia when I was about 30, and that opened up trying to find a lot of answers through lifestyle. And I'm so glad I did that, because through the next years, as I sort of, just wore down a little bit more, all those things that I implemented, like a gluten-free diet, learning about anti-inflammatory foods and taking supplements like activated B vitamins, those things were all very stabilizing for me. And I was amazed what a difference it made. Fast forward to a couple years ago, 5 years ago now, I'd already gone through chronic pain that I sort of was able to, after 7 years, get on top of. A sports doctor in Australia diagnosed me with hypermobility in my hips, and she offered me cortisone injections, but I didn't want to do that, and because I was into holistic stuff, so I thought I'm going to try glucosamine and all these arthritis kinds of things. Who'd have thought that back pain was a joint problem, right? So when I did that, I actually got better quite quickly, and quitting gluten at that time was a big help. But I didn't look further into the hypermobility. I saw an osteopath. I took good care of my health. I learned how to exercise in just the right way so that I wouldn't be in pain. And I found that the stronger I got, as long as I maintained muscle, I felt better. So at a time when I'd sort of atrophied, when I was in really bad sciatic pain and I stopped doing everything, I was at my worst. I was like a bag of bones walking, just so weak. So I learned that on my own. I figured that out, and I figured out exercise, the right diet, and I did okay. But a few years ago, when I moved, a big overseas move due to a family crisis, and my body just completely broke down like it hasn't broke down before. I don't know if there was a virus involved at that time. There was sort of, I don't know if the virus triggered something, but after October 2018, probably about 6 months later, I just wasn't myself. Prior to that time, I'd been running an online nutrition program. I made a cooking show in Australia that's still out there, Eat and Love. And I was very creative, able to write ebooks, able to do Instagram posts and videos and share the nutrition information I had. And I was really passionate about it. I needed to rest after talking at events. But I found a way to do it. And that changed after I moved back here. And I took custody of my niece, so became a mom again, and to a little one. And then just the move and some stressful things that happened, my body I just completely changed, and I didn't know what it was. And I was in the doctor, talking to her. I got hormone testing done through, which I ordered myself through Genova. My hormones seemed okay, but my cortisol was high. I went and got a brain scan. I was looking up all these alternative things. It showed that I had a nervous system like people with PTSD. So I thought, okay, I guess I have PTSD. Maybe the stress of everything has finally caught up on me. I guess but I wasn't improving. None of that was helping me get better. So I was tired. I struggled to do housework. I struggled to make it through the day without a nap. Every day at 5 o'clock when I was cooking dinner, I was just like snappy and jumpy. And my therapist thought maybe something happened in my past. And it was a PTSD thing. So I was noticing so much, and talking to different health professionals, but there weren't any answers. I was just rolling along in this vortex, spiraling. And eventually my sleep just got so bad. Loss of creative thought, and then severe insomnia were my worst symptoms. Now, the interesting thing is, those aren't what doctors are looking for people with POTS. Doctors are looking for fainting and lightheadedness. And those were not number one for me. But I got an Apple Watch in December of a few years ago, right before I got diagnosed with POTS. Oh, excuse me a sec. And the Apple Watch showed I went snowboarding, I think it was my first or second time, and I was huffing and puffing, and I realized after the day my heart rate was 185. And I thought, that's really high. And then I started to watch it, and I noticed that when I did Pilates, that my heart rate was lower when I was doing the recumbent on the mat stuff or lying down, and then it spiked up when I got up. So I made a doctor's appointment, told this to my GP, and luckily she knew one other patient with POTS. And she said, have you ever heard of POTS? And I had never heard of it. And I'd been talking about the nervous system and learning about adrenal burnout, adrenal fatigue, this stuff that holistic practitioners talk about. But I didn't know about dysautonomia and about the whole nervous system completely breaking and what that might look like. So it was a stroke of luck that she knew. And but that was only the beginning. From that point, she didn't know much about it other than what it was. It took still a year to get diagnosed and get medication. So that next year was hell. Like the delay of diagnosis cost me so much of my mental health. It was such a struggle to know that I might have POTS, but have to wait. I'm in Canada, so I had to wait 4 months to get the Holter monitor. And then after you get the Holter and check your heart, then you're waiting to see internal medicine who's going to assess you before you can go see the actual cardiologist or specialist. And through that time, I joined Facebook groups for people with these conditions, and was able to identify one of perhaps the 3 doctors in British Columbia who can diagnose POTS. Because if you go to the wrong doctor with POTS, they're either going to say, I know about POTS, it's no big deal, just increase your salt. Or they're not going to know that it can appear in so many ways it can appear as it looks like a psychiatric problem. It looks like I had PTSD and anxiety issues. It looked like I was a tired mom. And yeah, I'm sad for the people that go through that. And I feel lucky that I had the health knowledge and some level of capacity to advocate for myself, because it took a lot to the first internal medicine doctor I saw. I was pretty convinced I had POTS. It was 9 months down the road since I'd heard about it. I'd been tracking, I'd been learning, and she didn't want me diagnosing myself at all. And she said, don't jump to conclusions. It could just be anxiety. And when I did the stress tests with her, I purposely didn't drink a lot of fluid that day, because that was kind of, fluid and salt was my only treatment, self-treatment in the beginning. And I was okay if I had enough fluid, but not really. But my heart rate was 200, just taking my top off to get the gown on. And then once it was up, it wouldn't go down. So it was clear in that something was happening. And so she prescribed me a medication called Ivabradine, which I'm so grateful that she was able to, that she knew about that, because it's not completely tested on POTS patients, but it doesn't lower blood pressure. It reduces heart rate without lowering blood pressure. And it's within 2 hours, I felt like a new person taking that. Like everything calmed down. I actually, what happened was the insomnia was from having my heart rate so high all day and having no capacity within my nervous system to bring that down. So that medication that lowered my heart rate just took the pressure off that gas pedal. After that, so it took a few months. I saw a doctor in Vancouver, and I sent her a video of what's it called? A poor man's tilt table test. I just did it myself, and I tracked my heart rate, and I took snapshots of throughout the 10 minutes how high my heart rate was. And I sent her all this information, including all my watch data and all the things I was doing. So she just agreed with my diagnosis when I saw her. And she agreed that because the treatment was working, there was nothing else wrong with my heart. Then that's what it was. And that was so validating and so comforting to have one doctor just say, you're doing the right thing. Yes, you're right. That's what it is. And this makes sense. And what you're doing makes sense. Because as a patient, it's just so, there's so much stress in being unwell. And in being looked at like I don't look sick, and having these emotional reactions that make me look unstable, where it's my body's doing it. I don't have a choice here, and breathing doesn't work for this. Meditation doesn't work. I took a meditation teacher training and have been meditating since 2014. And none of that touched this. This is something else. So once I got the POTS diagnosis, I started deep diving into all the research I could find. So Dysautonomia International is a great resource for patients with POTS. And so many people talked about EDS. And I knew I had this hypermobile, like being associated with POTS. And I guess the statistic I know is that 70% of EDS patients have POTS, somewhere around there. It's high. And so yeah, I wasn't sure. I honestly, I didn't know if I'd get a positive diagnosis for EDS. I thought maybe generalized, hypermobility, or it's such a confusing thing to diagnose. So I don't want to go there. But eventually, from hearing people talk about it, I found a doctor in the Comox Valley where I live who has EDS herself and has special interest in it She trained as a geneticist and works as a family doctor. And I went and saw her, and I got 6 out of 12 on the Baton score. So that was a positive diagnosis. In that period as well, after I saw the cardiologist, I had asked, because of what other patients were saying, I'd asked my doctor to refer me to a neurologist for kind of like intense neurological symptoms, which I think are partly explained by the EDS now, but like stabbing in my brain, feeling pain inside my head that wasn't a headache. It was my brain feeling it. Hot hands, hot feet, tremors, internal tremors, vibrating through like the heel of my bone, or feeling like I'm shaking all over, but nothing's happening. So for quite a while, it was great to get the POTS and the heart rate under control, but there was so much more happening, and I was still in so much distress, and my wonderful cardiologist didn't know anything more than the heart. So, but I was getting refused by neurologists and rheumatologists. The rheumatologist I finally just spoke to a couple of weeks ago doesn't deal with EDS. It's just crazy, the bounce around that I've had for medical professionals here. And I still haven't found a neurologist who will understand what's happening with me. But I am looking, because I think it's important to be understood by doctors. I don't think it's fair that I'm not finding people that understand, and that I have to carry this myself. But where LDN came in is in my deep dive of research, where I thought maybe I should go find out about EDS and get an assessment. And I was looking at, there was so much information, in Dysautonomia does like an annual conference, and they interview 30 doctors, and then they record all the talks, and they're basically for medical professionals or patients. So I came across one about LDN, and this is in like the third year or something. Like it's not that long ago. So I started taking it last November, but I'd heard about it during that summer's conference. So that would have been the 2002 conference. And I wasn't sure. I didn't have an EDS diagnosis then. I was like, does this work for POTS? This seems like they're saying it might. It just wasn't a guarantee, but luckily, so I tried to get into a rheumatologist in Australia, and he was booking about like 4 weeks out. So it was such a short wait, but he couldn't see me. I tried the dual citizenship card, but he couldn't see me by telehealth. So I asked my doctor, my GP, and she actually knew about LDN, and she was happy to prescribe it. And I thought, why didn't you tell me about it? But she didn't know. So nobody knows. We're all sort of in this place of not talking about it because we don't know enough. So information about this is power, and it's life-changing. So the first I got the LDN prescription last November. That week, there was an event at a store where I do their social media, but I work from home and I don't go in, and it's usually going into the store and taking photos for marketing news. It's so tiring for me, and it is, so I have to really bank that time and make sure I could recover after. But that week there was an event, and I went in and did everything and felt normal. And that was on 0.5 milligrams in the first week. I was so overjoyed. I felt like I was me. And from there, I increased slowly every 2 weeks by 0.5 to go to titrate up very slowly. And the more I did, and the longer I was on it, the better I got. There was the side effect I had that was very distressing was with the Avicel filler. Sorry, my nose is all seasonal changes, and highly sensitive. So yeah, the Avicel filler made me feel like I had stomach ulcers. So I was in so much pain, and luckily in the LDN group, people talked about that, and I was able to dilute the stuff I had and then go back and ask for a new filler. And my pharmacist recommended hemp protein filler because she had one other patient doing that same thing and it worked. So that's what we did. Then all that stomach pain went away. And as I went up in dose, I guess it was like the LDN was giving me energy. And so it would keep me a little bit awake at night, but it wasn't like my previous insomnia where it was so stressful and like I was having, like, it was such a nightmare to be awake. It was kind of just a little bit of a nuisance, but it wasn't such a bad feeling, and it would go away after a few days. So for me, I definitely responded really well, and I was really excited to go up in dose. Tricky part is figuring out what your dose is, and I went up to 5.5 and then kept thinking, I don't know if I should go higher or lower. Maybe I was better at 3. And then I came across some research from a Danish study that talked about twice a day dosing for inflammatory conditions. And for me, I don't have any autoimmune markers. I don't know if my POTS is autoimmune or not, but I don't have the markers, and I do feel inflammation. And I feel that a lot of my symptoms, oh, that's my cat and dog. Just a big bump over there. Yeah, but I do feel symptoms of inflammation. And so that made sense. I read that research and I went, well, I'm at 5.5 right now. Why don't I try 3 and 3? And I tried that and I slept like a baby. I just slept perfectly the first night I tried it. And I've stayed on that. It's been a perfect adjustment. Taking 3 milligrams in the morning and 3 milligrams before bed. And you know what? I think that the most important part of what LDN has done is it's made it so that all this lifestyle stuff that I need to do to manage POTS and EDS, like I need to exercise, but I can't do that if I haven't slept, or if I'm in pain, or if I just feel so tired. So the LDN has given me back energy. It has helped me sleep. And it's like it's laid the foundation for my body to do the things I need to do and for those things to work better. And not to mention being able to feel a little bit creative. I mean, I'm not 100% there, but there's definitely so much more. And it's noticeable to my family, my friends, my daughters. They feel like they have me back, Sita back. And that's one medication that made such a profound difference in my life. I wish I could say like it's going to work for everyone. I'm sure that for those of us it does work. We want everyone else to try different doses and try it in different ways. And I do encourage people to keep trying, because I think that once you find the right dose for you, or perhaps it works when other things are happening too. I don't know. Like, it's hard when you do quite a few things. I'm like I like my blanket treatments. Like I'll take it all, and maybe I'll slowly let go of some things and see if I can, but I want to get better. Like I'm very motivated to get better. So I tend to do whatever makes sense. If I have access to it, I'll give it a try.
Okay, so Before you started LDN, if you had to rate your quality of life on a score of 1 to 10, 10 being the best, what would it have been?
Like a 2, 3.
Mm-hmm.
And it's interesting too, because I thought that a lot of the symptoms were mental. Like it was starting to feel like, I wouldn't say I've ever been clinically depressed, but I was so down because I felt so bad. And so my whole quality of life, even having that little edge taken off my heart rate by that first medication that was such a relief, that didn't give me quality of life back. It just gave me, it sustained me a bit, put a little band-aid somewhere. The LDN has allowed my body to start healing. And I feel that. I feel the goodness now from exercise. So I can exercise for an hour, and I've worked up to doing, like very similar to what I did before I was really sick, which is sort of resistance training to make sure that but with very light weights, but just a little bit of resistance training and intervals. And I feel good when I'm doing it. Kind of can do like a little dance for a minute and pretend that being upright doesn't bother me, even though it still does. I still have POTS. I still have to manage my energy and manage what I'm doing. But I feel more like, I feel like I'm healing. I feel like I'm getting better and better. And that's quite an incredible thing with something I was told is untreatable. And then even when I looked into the holistic stuff, that I think people with hypothyroid, there are some diets and there's some lifestyle things that you can do where you can actually, really put that into remission. But POTS is different. And because the nervous system is affecting the mind and the body. It's such a widespread symptomology. That's not really a word, but like it just affects everything, POTS, once this has happened to your nervous system. And so LDN is allowing my body to heal in all these little micro sort of ways, to have a little bit more energy, to be able to exercise, to sleep. Like, yeah, that's where the body heals, right? So thank God for sleep. And but LDN's done more than that. It's given me energy. It has I don't have those brain symptoms as often. Every once in a while, I'm so sensitive to the weather. It's like the low and high pressure. It's like it's inside my body, and I can just completely feel it happening. But it's just, it made me so much stronger.
I know you're on your healing journey, you're not there yet, but what would you say your quality of life is like today?
Yeah, I think I'm up around a 7, 8. I actually I had another treatment done called a dual sympathetic reset, and I had to travel down to the States to get it done, which before LDN I wouldn't have been able to do. I didn't go to my friend's wedding in Bali last summer because I was too sick before LDN. And this summer I was able to travel down to the States, and I got a treatment that reset my sympathetic nervous system. And it was amazing because we went down and did the trip with my daughter and my partner. And it was so amazing to be well enough to go do that. And then the treatment, the sympathetic reset, which if anyone wants to look it up, it's by Dr. Eugene Lipov. And it is a PTSD treatment. But the theory for me was that POTS and PTSD are both autonomic nervous system disorders. And so if it can help PTSD, and my symptoms were so similar to it, perhaps it can help me. So we did the dual sympathetic reset. And since then, I guess like my daily steps that my watch tracks were around 6,000 a day, 7,000 with the LDN. And then since I've had this other treatment done, I'm up around 9 or 10,000. All of a sudden I can go all day. But I also think that because I've been on the LDN longer, I'm just getting better and better. So it's being able to participate in life. Like, it's be there with my daughter, taking her to the zoo, and be able to go out for meals and have conversations without feeling like I'm going to have an aftermath to deal with. The aftermath now is very minimal. Like I might need to have a little bit of downtime, but it's not a complete crash. So yeah, I feel like I'm back to where I was before I moved over here, when I was, doing talks and writing and really in my, what's that word? Like when you're in your, you're just really being yourself in your element. And I feel that some of that back. So I feel happy. I feel joy.
That's good. Well, what an incredible, amazing story. And we wish you well with continuing your journey. And we'll have to have you back maybe next year and see how you're getting on.
Oh, I would love that. I would absolutely love that. It's been a pleasure talking to you. Thank you so much for having me.
Thank you. So you take care. Bye-bye.
Thank you. Bye.
Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.